Good morning. I'm Don Walker, and I'm Communications Director for Brevard County Government. Thank you for joining us this morning for our weekly, or almost weekly, update on the COVID-19 pandemic. And we have a panel today that includes John Davis, who is the Community Health Nursing Director for the Florida Department of Health Brevard. We also have our Public Safety Director, Matt Wallace. We have Jesse Ray, who is the County Social Media Specialist, who will be monitoring our Facebook Live event for any questions that may be posed to us by our audience and from the media. And we will go ahead and get our program started today with the update from John Davis from Florida Department of Health. John?
Okay, thank you, Don. We're looking better each week. Certainly over the last 3 weeks, every week gets a little bit better. However, it's been a bit of an elongated downslope. We were hoping for a quicker drop off, but nonetheless, we are continuing to head in the right direction. Last week, we were at 687 cases per 100,000. And I'm anticipating with the numbers we're seeing day to day that this week, later today when the numbers come out, we're hopefully at a little bit below 500 cases per 100,000. Again, as I like to do, I want to put that in perspective. So again, anything over 100 cases per 100,000 puts us at a community of high transmission. So we're certainly still there, and we have a ways to go, but our trends are looking better. Looking back over the last 2 months, it seems our peak was back in January the 11th. On that day, we saw over 2,400 cases in a day. Now, for the first time in a while, we're starting to see cases below that 300 mark daily. So again, we're heading in the right direction there. When we were at the peak there, we were looking at a 30% positivity rate. And again, that's about been cut in half. I expect we'll be around 15 to 16% when the numbers come out today in terms of positivity rate. So again, another indication that we are heading out of this surge, and we're going in the right direction. Testing wise, we're certainly seeing less demand there as well. We're starting to see folks where, at least at our facility, where we're getting below 200 tests a day. And I think a lot of that's just because the availability is there for folks. And certainly you can even order them by mail now at covidtests.gov, and they'll send them right to your house. If you have insurance, you should be able to purchase them at pharmacies and then get reimbursement from your insurance company. So again, testing doesn't seem to be an issue at all. Those that need testing should easily be able to get tested. Hospitalization-wise, new COVID admits have dropped. Statewide, it's dropped about 30% over the last week, a little less so here, but close to it. Those trends in the ICU, not so much. There has been a slight decrease, but not as dramatic as the overall hospital admission decrease. Vast majority of those talking to the hospitals are unvaccinated. Long-term care facilities, we are still seeing outbreaks, but they are slowing down. And thankfully, we're not seeing a lot of hospitalization out of that group, likely due to the high vaccination rates in those age groups in the nursing homes. Deaths, we do still see deaths on a daily basis. It's one of the last indicators that's truly going to turn around. Again, hospitalizations and deaths typically lag a bit after we start seeing a drop in cases. I expect we'll start seeing that continue to decline quite dramatically over the next 2 weeks. School-wise, again, a reflection of our community. Certainly looking at their dashboard, the last 3 days, there was, I believe it was close to a 70% drop from the 3 days prior. So looking better in schools as well. Again, a lot of this, if you're interested in specific data, you can go to the CDC tracker website. and go to the county level. One thing I noticed on there that was of interest is they have added a category for wastewater data. So the wastewater facilities across the country that are being, they did a pilot program where they're looking for the virus in wastewater. I believe we have the one in Cape Canaveral, and then I think there's 2 or 3 others in the state of Florida. So you can go on that site, and although they haven't updated Florida, I think for the last 2 weeks, there are some data available for the rest of the country, and the trends are definitely dropping there. It's pretty evident when you look at that. So where does that leave us now? We're still a community of high transmission, although we're heading in the right direction. Our vaccination rates have essentially been at a standstill. We did increase, I believe, 1% over the last month. So from 69% to 70% of our overall population is vaccinated. Preteens, 18%, teenagers, 51% of that age group vaccinated. 25% of our population has been boosted. So again, the message remains the same. Continue to be vigilant. If you're not vaccinated, seek vaccination. If you are vaccinated and haven't had the booster, seek the booster. Certainly hand hygiene. If you're sick, stay home from school or work. If you're going to be in very crowded indoor public settings for any length of time, probably a good idea to wear a mask. And again, we just need to remain vigilant, and we're heading in the right direction.
All right, thank you, John, for that update. We'll now turn it over to Matt Wallace, the county's Public Safety Director, for an update on from Emergency Management and Public Safety.
Thank you, Don. And good morning, Brevard County. Thank you for tuning in with us again on the bi-weekly updates that we have as we work through the COVID-19 pandemic. I'm just going to reiterate from an emergency management perspective across the county a lot what John has just talked about, and we can start off with testing. Across Brevard County, we still have testing available in the north, central, and southern parts of the county with great partnerships with Department of Health, Emergency Management, Parish, and the City of West Melbourne. Those sites continue to remain open, even though the demand at those sites continues to fall. We'll continue to have those sites open. The Parish Medical Site can be found at 921 North Washington Avenue in Titusville, as is up on your screen. Department of Health in Brevard County can be at 2555 Judge Fran Jameson Way here in Viera. And the location to the south in West Melbourne can be found at the 300 Minton Road down in West Melbourne. So again, those sites continue to stay open at the times and dates that are up there on the slide. So continue to encourage those, if you do have symptoms and you want to go get tested, please visit those sites for expedient testing. Also, the thing that John had talked about is the at-home COVID test kits that are available now through the federal government. Go to the website, www.covidtest.gov. You can sign up to have those shipped to your home. There's a limit of 4 per residence, and those will be delivered to your home via the United States Postal System. So again, if you're interested in having those at-home test kits, please go to that website, sign up, and those tests will arrive in the mail, hopefully within about 7 to 12 days of that you order them. So there are resources out there for testing. Just reiterate the things that John said about hospitalizations from emergency management. We see the same thing. The numbers are down, going in a good direction, not quickly as we thought, but again, we always see that 2-week lag that we have between when we have surges and then when we have the surge that comes into the hospitals. Again, the same things that John had talked about as we come out of this particular variant and our numbers continue to get better. We're still not there yet. We are a high transmission community, as John said. So from an emergency management and public safety perspective, we still want to encourage the proper things that we've been doing for the last 2 years. Use face coverings when you're in a crowded area. Social distancing, be mindful of where you are and what you're doing. Wash your hands, get vaccinated, get boosted up. And probably the biggest thing that John said as well is if you're not feeling well, stay home and have your children stay home. That will limit the spread of the disease probably better than anything that we're doing out there. Keep it in your house and keep isolated. So again, thank you for your vigilance throughout the county as we continue to fight this. We're continuing to make good strides and move in the right direction, and it's a community effort. We as government officials can stand up here and talk all we want, but without the community being involved in doing those actions and getting behind these things, it wouldn't make a difference. But we are making a difference because of those great actions that you guys have. So we appreciate it. We, again, thank you for tuning in, and thank you for being part of these bi-weekly updates that we have throughout the county. And Don, back to you. Thank you, sir.
All right, thank you, Matt. And I know John and Matt have both mentioned the CDC recommendations to help keep yourself safe. And of course, that's really important, especially this weekend, Super Bowl parties and things like that that are going on. Of course, Valentine's Day on Monday. So, be vigilant, as we always recommend. We're trying to do everything we can to stop the spread of COVID-19 in our community. I also wanted to mention that the county still has ample funds available for rental assistance and utility assistance for folks who are in need. We've got over $8 million in funding available. We're taking applications for rental assistance at all 17 county libraries, and you can also get an application form for that on our website at brevardfl.gov. And the main thing that you need to know is if you need assistance, the time to ask for it or to apply for it is when you realize that, the upcoming month is coming and I don't foresee that I'm going to have the money to pay for that. If you wait until you get a notice from the court, by that point, you've waited too long. So as soon as you realize the need is there, that's the time to get the application process going. There are certain forms that we ask for, financial forms, lease forms, things like that. We have to have those records to provide that assistance. So be prepared when you do apply to have those documents available for us to help you out. So at this point, I'll turn it over to Jesse Ray, who's been monitoring our event, for any questions that have been posed by our audience. And Jesse, I turn it over to you.
Thanks, Don. So I'll start with the media questions first. The CDC vaccination rate is different than the FDOH vaccination rate for Brevard County. CDC reports that 66.5% of the eligible population is fully vaccinated and 77.9% of the eligible population has received at least one vaccine, while FDH reports 70% of the eligible population has received at least one vaccine. According to the weekly report by FDOH, the FDOH uses 2021 population totals as the denominator, and according to the CDC footnotes, the CDC uses 2019 population total as the denominator. So why did FDOH choose to use 2021 numbers rather than the 2019 numbers like the CDC?
All right, well, I'll start off with that, and then John, if there's anything you want to pipe in on that. But, we talked about that before the start of our program today. First of all, we don't dictate what CDC does, nor do we know why they choose the numbers they choose or the reference numbers that they pick. So we can't speak on that. And from an FDOH standpoint, the main thing is that we are consistent with our numbers, that all of our updates are based on those numbers that we've used in the past. And that's the main thing. We want to relay the message to our community of what we're seeing here locally, and to provide information that's going to help keep our residents safe. So if you've got anything to add to that, John, you're welcome to.
No, that's an excellent point, Don. I would just second that. But, again, if you look on the CDC website, you go down to the asterisk and follow it down, and you'll see the data variation statement at the bottom, which states that the data presented is a metric that's used across the United States. However, data on this page may differ from data in state and local websites. This can be due to differences in how the data were reported or how the metrics are calculated. So as Don said, I can't speak to why they use a certain year, and maybe it's different with the state. But the numbers that we are given have remained consistent. We're using the same database. So another thing that can cause some variations is some areas track the total the total number vaccinated based on their population. Some numbers are reported as vaccine eligible folks, so that's going to eliminate some of your population, like age 5 and under 5. So that can cause some variation. Sometimes you'll see total vaccines given, so this would include any vaccination given in the county. However, when you're talking about rates of county residents, obviously that's only going to speak to those that have addresses here in Brevard County. So you would expect to see a little bit of variation based on what kind of metrics they're looking at.
Okay, and that may also segue into our next question, and we may
Yes.
have touched on some of the answer to this.
Yeah, you might just a little bit. So the second part of that question is also, does FDOH count non-residents in its vaccination rate for Brevard County? And how do snowbirds impact the vaccination rate in Brevard County? Does it decrease or increase the vaccination rate?
No, well, it would be vaccinations given, but it wouldn't change the percentage of our population that's vaccinated. That's Brevard residents.
Okay.
And I should add to that, if I were to have been vaccinated in New York, I would count in their vaccination rate. So I don't think that, I think that's applicable across the board is what I'm saying.
Yeah, absolutely. Okay, so is there any way to see the other factors associated with COVID-19 deaths on any of the dashboards that CDC has or FDOH?
I'm not sure I understand the question. Is there a way to parse out what the...
Yeah, so basically they're trying to say, so they died of COVID-19. Were they a healthy, young 25-year-old with no issues, or were they a 60-year-old with diabetes who was overweight?
That's not on the data tracker. It's just going to give you numbers. Again, that data is being tracked. And that's why when you see general reports where they'll say a certain percentage or over a certain age, yes, that's being tracked. Again, the vast majority of what we're seeing here is older folks, elderly, and particularly elderly with multiple comorbidities is the vast majority of deaths in the county. But no, we don't release numbers. I mean, you start getting into some tricky areas there in terms of calling a death related to COVID or not, or as opposed to something else they may have, and then you have to parse all that out. It's a lot of going through medical records, and so that's not something that's really we're going to have other than just straight numbers.
Okay, and this is going back, maybe all the way back to the basics, but since you mentioned the comorbidities, just give us a couple examples of what you're talking about when you say comorbidities.
So those would be medical issues that folks are having, and typically long-standing medical issues, diabetes, heart disease, certainly infections from other diseases, cancer. Certainly one of the issues, and I think it's definitely been studied and put out there, is that obesity is a very high risk factor. And we know we have an issue with that in this country. And that's been shown, and I think that's part of why we're seeing the death rates we do is because of the nature of our population. Again, when you look worldwide on some of the deaths and you say, well, why is it so much higher in the U.S.? Well, for one thing, we have more elderly folks. We have a longer lifespan here. So as folks age, they typically, their immune system wanes a bit. If you have a condition, it typically gets magnified a bit as you age. And so we have more of that kind of population here in our country, and that's reflected in the higher death rates we're seeing right now.
Right.
Thanks,
And it's like, if you remember when we started rolling out the vaccines, we were rolling them out to the high-risk populations. And a lot of that high-risk population wasn't just age, although age was a big factor, but it was age and some of these comorbidities that you're talking about. So yeah, I definitely think that, like you said, we're tracking it, but there's nowhere for people to find that information as far as this percentage of COVID deaths was also because of a comorbidity or something. Right? No.
Yeah, I think, and again, when studies are coming out continuously, the CDC is a good place to go for some of the latest on some of the study releases, and one of many websites. But as this thing continues, there's going to be studies coming out for years, and we'll refine our knowledge about this. And I'm sure at some point those statistics will be widely available, but on a day-to-day basis now.
Sure. And it looks like the last question that I really have is, are there any other like healthy lifestyle advice for fighting COVID infections? And I guess that kind of really goes into what we were just talking about as far as obesity being, one of the top comorbidities. So, I guess trying to manage your weight might help. Is that accurate?
Absolutely. I mean, I think that's true of anything. I mean, it's no different with COVID than anything else, any other chronic diseases we track. I mean, you're going to have a percent of people that, due to genetics, no matter what you do, you may have a medical issue. But certainly those things that are choices to be made, I should say, that are non-genetic, whether you smoke, your activity level, your physical fitness, your diet, all those things are tremendously important. I think, with us dealing with this COVID, the rates that have just been tremendous that I don't think any of us ever thought we would see. I think it's brought that to the forefront. That these things that are talked about all the time, like eating healthy, keeping your weight in check, being physically active, that messaging's been out there a long time. But I think now with what we've been dealing with the COVID pandemic, it's really brought it home that there's a reason that message is out there. Those things make a difference.
Yeah. Don, I do have one more that
Okay.
came through. Do we know the percentage of COVID patients that are having rental issues? You talked about the rental stuff.
Well, I do know that I can give you the number of applications we've received. We've received over 2,000 applications, and the average amount that we've paid per household of those 2,000 plus is just over $5,300. So, yeah, I mean, at one point we had, as much as $18 million at one point, $4 million from CARES Act dollars, and then the other $18 million through the ARPA money. But so with $8 million left, we've obviously spent $8 million to help residents of our community to this date. And that's why we're just trying to continue to spread the word, because even though, there's an ebb and flow of where we've seen peaks and valleys in this pandemic, that doesn't mean that people are suffering any less. So, we're just trying to get as much money into the hands of those in need as possible. So that's why we want to continue to keep reiterating that if you have a need, please fill out an application. We've got the money there to help you. So
Yeah. And that's all I got today.
all right, very good. Well, I did misspeak at the start of our program that we're doing these weekly, but because we are seeing a downward trend, we have started hosting these on a bi-weekly basis, or every other week basis, what I should say. And so we will not be here next Friday, but we do tentatively plan to be back on February 25th for our next update. And with that, I'll conclude our program. Thank you for joining us today.